Well, we've had lots of preparation, so we've known it's been coming for a long time. What we've aimed to do is to inform staff that these changes were coming on board, and I think this has been a big help really, that the staff have adapted to this change really well.
He seems to be getting much better.
Within a short space of time, probably 6 training days on the ward, we were able to move to a paperless system. Thus the observations were all completed at the bedside with the handheld device, without the need to document them onto a traditional temperature, pulse, respiratory paper chart.
We had paper observations charts and the computer observation charts for around about 2 weeks, just so the staff were allowed to get used to using the machines but had the paper as a backup, and then we slowly withdrew the paper versions and kept the computer versions. During all of this time, the patient track team were on the ward every day, giving training, and if there's any problems they would rectify them immediately.
Initially, I think it felt like quite a big change in working practice, and quite a few people were a bit unsure about what it was, but there's been lots of training, and I think particularly now we've been able to see the data that we can get from Patient Track. A lot of people have really taken it on and are really quite enthusiastic about it. With any change in working practice, I think there's always going to be difficulties and challenges. There was a lot of work done with the nurses on the wards in terms of getting them trained in using the system and getting them to a good standard of acute care. I think it was a bit more difficult with the junior doctors because we are a more disparate group and we're always on call or on night shifts. So because of this, we've devised a role to go along with Patient Track, whereby the certain doctors on the wards will get extra training to be able to train other people, other doctors on the ward, so they can catch them on the night shift or when they're working. So I think as well as being a system that's been implemented to try and get patients seen quicker, there have been other benefits in terms of just getting people to focus on the acute care training and knowledge of all the staff, including junior doctors.